heart disease is a multifactorial disease, meaning there's many different things that come into whether or not someone ends up developing heart disease. And there are some things we can't change, right? Heart disease risk goes up as we age. And if we have a family history of heart disease, we can't change our birthday, we can't change our family. So those are intrinsic risks that we have. The rest are modifiable. There's a couple that we have sort of a lot of control over from the way we act. So it's physical activity, so being inactive increases your risk, and smoking obviously increases your risk. So quitting smoking and becoming more active are really important to help reduce cardiovascular disease risk. Now, there's 5 other risk factors, and that's high cholesterol, high blood pressure, high blood sugar or diabetes, excess weight, and poor diet. And if you think about that, those 5 risk factors are all food related. So the vast majority of cardiovascular risk is related to diet. It's the foods we put into our body, which is why it's so important. It's so important to pay attention to what you put in, right? I mean, I return to this analogy often when I talk to my patients, and that is, we fuel our cars better than we fuel our bodies. Right? If you drive up to a gas station and you open up the gas tank and you look on the side and it says, on the inside, the instruction says, premium unleaded only, right? Would you ever think about putting in diesel? Of course you wouldn't. You know that would wreck the engine, right? And yet we put in diesel into a machine that requires premium unleaded, or however you want to use the analogy, but we put in the wrong fuel and then we expect it to run perfectly. It won't. We have to try and put in the right fuel. The great thing is our bodies are incredibly resilient, and they can actually reward you with improved health, with resilience, as you improve your diet. So that's why diet is really, really important, and that's why step 1 is so focused on nutrition, and those are the risk factors. So very much food related, and then obviously if you're smoking, please quit. If you're inactive, start moving. Even walking around your couch a couple of times is better than sitting on it all day. It's every little bit helps.